I'm sure you guys are all here for various reasons, but well aware of the fact that wildfire activity in Canada is of growing concern, growing interest. There's about 7,000 wildfires occur each year in Canada, and they burn just shy of 3 million hectares on average. Interestingly, about half are caused by lightning strikes, the other half by human activity. The leading cause is actually unattended campfires. And with these lightning strikes actually account for about 85% of the total area burned, mainly because they're more likely to occur in remote areas. And so there's sort of less interest in some fire suppression as opposed to something closer to infrastructure or a built environment. As many people know, 2023 was an unprecedented year with about 15 million hectares of forest area burned, and that was about 4% of the forested area in Canada, so it's quite substantial. As shown in this map produced by NRCan, what we see here is basically the outlines of fire areas for about 23 years, from 1980 to 2023. And we can see is that the forest fires are really associated with the boreal forest zone in Canada that really stretches from coast to coast. So as was noted, is that wildfire smoke is a major source of air pollution. And there's a whole bunch of air pollutants in the mixture, including particulate matter. PM2.5 is one of the most studied. Carbon monoxide, NOx, VOCs, PHs, and ozone. And so these are present in the smoke. Highest concentrations are areas close to the fires, but also can travel great distance and cause health effects thousands of kilometers away. As we probably all remember, most of us remember in 2023, Canada made the news with Canadian forest fire smoke making its way into the northeastern part of the United States. And so smoke travels the borders, just as states from the Pacific Northwest comes into Canadian provinces as well. So wildfires are leading contributor to population-weighted PM2.5 in Canada. They account for about 17%. This is actually quite interesting because transportation sources as well contribute for about 17% as well of the population-weighted exposure. And so wildfires are quite an important source of exposure and need to be considered for the health effects. So as was noted in the introduction, Health Canada conducted a weight of evidence review of the health outcomes associated with exposure to wildfire smoke. Basically, this provides a scientific evidence base to inform our health portfolio guidance and actions on wildfire smoke. And there was a lot of interest in having this report done. Basically, we found in the last couple of years that research activities, research interest on wildfire smoke had become much more prevalent in the literature. So there was a good evidence base for which to do a report like this. And also there's a lot of interest in wildfire smoke because, as noted, wildfire activity, including frequency and severity and lengthening of the fire season, is anticipated to a result of climate change. And so if anyone would like a copy of the report, it's available on publications at gc.ca, or just feel free to reach out to me and I can send you a copy. C'est disponible en français aussi. So with that, as noted, health effects wildfire smoke is a really active area of research. However, it's a tricky area of research compared to other sources of air pollution. Mainly the exposures are seasonal episodic. If you think about sort of your, say the work I do on traffic-related air pollution, is that largely other than the diurnal pattern of the morning and afternoon commute, is that there's actually a relatively stable amount of traffic-related air pollution. Or if you think about other point sources, like a town located near an industrial facility, it's a rather stable amount of air pollution being, the people are being exposed to. But in this case, you get these peaks of exposure. It really only happens during a few months of the year. And so it becomes a little bit more difficult to study. Also, the exposure level and duration can vary considerably. So you can have really intense smoky days that last for a few days, or they can last for a couple hours, or basically some of the research that I've done shows that the air pollution level can actually be sort of like a relatively stable background or a low level throughout a whole summer period. So it's not quite as clear cut. And a really big issue is the need to distinguish between wildfire-specific exposures from other sources of air pollution. So when you do these types of studies, we're looking for the health effects of air pollution, is that if you want to attribute it to a certain source, you want to be sure that the exposures you're looking are attributable to a specific source. And so when it comes to wildfire smoke, typically the studies look at wildfire PM2.5, so that's the size of the particle, or else wildfire PM10, a little bit less common, but they exist there. And this refers to the size of the particulate. And also the comparison of smoky versus non-smoky days. That's a bit more of a crude metric, but those studies actually work quite well as well. And so the epidemiological studies have investigated these health effects by comparing the rates of health outcomes that occur associated with a fire period and non-fire periods. And so really the strongest evidence is there for adverse respiratory effects, mainly exacerbation of asthma and COPD, resulting in hospitalizations or ER visits. And there's also strong association for premature death. There is some evidence for cardiovascular effects, with really the strongest evidence coming for those 65 years and older. One factor with this is that it's a smallish increase in risk, and just that people under 65 largely don't go to the hospital or have healthcare utilization for cardiovascular effects. So it's a little bit harder to, it's harder, period, not a little bit harder. It was harder to detect that uptick from baseline rate. And also the main evidence for reproductive and developmental effects are on low birth weight and preterm birth. And so there's some studies that look at other health outcomes, but those are the main ones that are in the literature. And so there is some evidence for wildfire smoke and mental health effects, though more research is needed. In the mental health sphere, which is of a lot of interest right now, is that a lot of the studies focus on people who have lived through a wildfire experience. And so the trauma of being in the wildfires themselves, as say like dealing with evacuations, displacement, loss of homes and property, loss of livelihood, all that type of aspect. It's very hard to disentangle what would be that effect versus a smoke effect on a person's mental health, although I would hazard a guess to say that sort of like more the direct trauma is a greater impact than smoke would be. And when it comes to the health effects of wildfire smoke, several studies have looked at like what's the mechanism, like what's the key for this. And with wildfire smoke, you've got this particulate matter that is quite small, it can penetrate into the lungs, and then from the lungs it can get into the bloodstream. And this is really where we start to get a lot of the health effects, where a lot of these health effects are mediated through an oxidative stress or inflammation type response as the key mechanisms. So this is where you get production of the reactive oxygen species and the inflammatory responses, and they starts in the lung, but then can lead to effects that occur throughout the body, and it results in other biochemical or physiological changes. So this is sort of the root of the adverse effects that result in, say, like an asthma attack or something that precipitates a premature death. Also, smoke particles can interact with receptors in the lung, activate the autonomous nervous system, and this results in changes in blood pressure and heart rhythm. So again, small changes to like our baseline physiology, but that can result in an adverse health effect, a manifestation of a health effect, and also evidence of impacts on the immune system. When it comes to public health effects, some groups may be disproportionately impacted, as was noted at the start. So there's a lot of evidence for young children, women, seniors, and people with pre-existing respiratory disease. And this group, as well as pregnant people, this group is one where there's an aspect of their physiology that is different than, say, a regular, normal, healthy adult that results in this disproportionate risk. There's also parts that's some people might have a greater exposure, and that is largely associated or more likely to be exposed to wildfire smoke. That's largely associated with indigenous populations or people living in remote areas or people engaged in strenuous outdoor work, which when it comes to wildfires, like a good important group within this is wildland firefighters. I really like this picture because it shows our wildland firefighters wearing some PPE but no respiratory PPE. So this is actually a really interesting one. People always find this interesting, is that the main risk mitigation approach for wildfire smoke is risk communication. And so risk communication to basically designed to reduce people's exposure. And at Health Canada, we recommend a layered approach. So pay attention to the Air Quality Health Index, which is known as AQHI in Canada. It's pictured here. Basically, the higher number, the greater the risk. And at 7 and up, if the AQHI is 7 or higher, it's considered a health risk to everyone. And 4 to 6 is considered a health risk for sensitive groups. And also, so in these cases, the advice is to limit your outdoor activities, protect your indoor air. So this is like we stay indoors with the windows and doors closed, use a certified portable air cleaner to keep that indoor air clean. And if it's necessary to be outside, wear a respirator like an N95 style mask. Although that is sort of an absolute more idea of like a necessary, not wear a mask and continue to do as you'd like. And a really important part on the effectiveness of risk communication really depends on sort of 3 aspects: having really timely and local advice based on AQ data, because these smoke episodes can be, they can impact a large area, but Canada is huge, and so you can have a smoke episode occurring in the prairies that doesn't necessarily impact, Eastern Canada or vice versa. So having data available and advice available for the population that's at risk. Also, a big part of this is the capacity of a person or a community to respond to the advice. So capacity for a person is, let's say the advice, like I've noted, is to limit your outdoor activities and to stay indoors with your clean air. But if you have no choice but to go to work and you're an outdoor worker, you don't really have the capacity to respond to the advice to that extent. Also, a big part of the community level for jurisdictions is providing, say, a clean air space. And do all communities have spaces that they can dedicate, like a recreational center or a gym or whatnot that can be converted into a clean air space? That's a different question, but still a part of that capacity to respond, and also the willingness to engage with advice. And I think for a lot of public health measures, it's a part about the willingness of the public that you're communicating to engage with the advice. So I guess we all have our various levels of risk tolerance, and so it's an element of that there. It's the person's personal decision. And so for anyone interested really in what is Health Canada doing for wildfire smoke, air quality, and your health, is that we have a great website, www.can.ca/wildfire smoke. And this is where you can get all sorts of information. There's a lot of great resources there. All sorts of information on the health effects, how to prepare for smoke events, how to protect your physical and mental health. And also it's got a link to a ton of our resources. I like the one report, but there's a lot of other great fact sheets and guidance, and a lot targeted for various audiences, including like community groups and a little bit for some more technical audience as well. And so, yeah, I think I'm a bit okay on time. My main collaborator for this report, this presentation was Roshini, and there's my email address if anyone has questions. And I can